I am here at Columbus Aesthetic and Plastic Surgery, the Easton office, and I am joined by Dr. Timothy Treece. So thanks for being with me, Dr. Treece.
It's my pleasure, Robyn.
We are going to talk about injectables right now, something that a lot of people hear of, and there are so many different types, aren't there?
There really are. It used to be we just had a little bit of Restylane or some Juvederm, and now there are so many different configurations, and they're all applicable to different situations. So it's really important that you pick someone who knows what they're doing.
Are injectables something that, people want instant gratification? They want to see results right away. Is that something that will give them that?
A lot of the time, yes. For example, say you come in and you're concerned about your nasolabial folds or the lines next to your nose or some fine lines around your mouth. An injectable will change that contour immediately.
Is this something that is good for people starting out before doing maybe a more invasive procedure?
Sure. Injectables are done often in younger people. As I've talked in the past, facelifts don't happen until usually late 40s, early 50s at the soonest. But a lot of people come in their late 20s, early 30s, and they're starting to see just a little bit of change in the way their face is shaped, and a little bit of that baby fat goes, or a little bit of the lines of being out and enjoying the sunshine start to show up. And so we start to think about gentle, minimally invasive techniques in the office to sort of soften the facial features and keep people looking young and vibrant.
And there are a lot of new ones. We're sitting next to a table with quite a few new names. Yes. Have they come a long way as far as, areas they can treat? How have injectables changed?
Well, there are a couple of new products that are kind of hot. First of all, our go-to all along has been Restylane and Juvederm. This is a product that's called a hyaluronic acid. It's a naturally occurring ingredient, and it works great for lips, it works great for nasolabial folds, and we've used that a lot over the years. But fine lines around the mouth, or adding volume to the cheeks and face, or adding projection to the chin or cheeks, we never really had great products that worked in these areas and were predictable, and we have some really cool new things now. So, for example, Restylane Silk came out this last year. It's very easy to inject. It's soft in the sense that it can go in the little tiny lines around your mouth. We never had something that was that delicate before. So used carefully, this is a great product, but it's used for certain circumstances. And, for example, really fine little lines around the eyes. This works great.
Right, the crow's feet people don't like.
Exactly, and we use Botox a lot for crow's feet, but this can supplement that. So in the right hands, you can do a lot with that. Here's on the opposite end of that spectrum. Sculptra is a product that's made out of an ingredient that's very similar to some of the absorbable sutures we surgeons have had for 25 or 30 years. And it's made into a gel that adds a gentle volume all over the face. It's injected in a slightly different technique. But let's say you're 34, you are a CrossFit expert, you are lean, mean, and your body looks killer, but oh, your face has lost its baby softness. This is a product that helps to bring a little bit of that back. So we use that in a little different circumstance. Voluma is another nice new product. And Voluma we use to add a little edge to the cheeks, maybe even a little chin. And it has a property that lets it stay up and give it some volume. It's called a G' effect. It's one of the chemists' concepts. But it's made a little differently, and it really works beautifully. Let's say you don't have very much in the way of cheekbones. You can get a little oompa with some Voluma.
A little boost. Yeah. I like it. So what about the time commitment? Does this take a long time for the procedure or for the recovery?
It really doesn't. In fact, today I just finished seeing patients in the office, and I saw, probably 12 people who came during work for a little volume added change to their day.
A lunchtime
and went back to work.
Lift,
a couple went home in the afternoon, but no, you can come. It's a short turnaround.
And should they come in and have a consultation before they decide what products they should use and what works for them?
Absolutely. I'm a big fan of patients coming to a private setting in the office, not trying to make these important decisions about your important, beautiful face in a party situation or whatever. I think they should be done in the privacy of an office with a little bit of time so they can understand the benefits, the drawbacks, and have reasonable expectations.
Okay, Dr. Treece, thanks so much for being with us today.
My pleasure, thank you.